Okay, Aidan, Carey, this is my child trauma assessment. Myself and my partner are called to the home where we find an 8-year-old in the backyard under a tree with his parents. The child is crying. The parents state they witnessed him falling out of the tree onto the dirt. They say the child landed on his left side and is cradling his arm. The child's mother has placed an ice pack on his left shoulder, and the patient winches when his shoulder shifts. The father seems protective and is agitated that first aid took so long to get to the scene. So before arriving on scene, my PPE is going to be just gloves. My equipment is going to be a backboard, trauma bag, and a jump bag. Considerations, we're going to consider C-spine. So as we appear on scene, we're going to announce ourselves as first aid, as EMTs. And on primary assessment, we find that the patient has a deformity to his left shoulder that appears to be a possible anterior shoulder dislocation. PMS is intact and the shoulder is painful to palpation, but there's no crepitus. So as my partner collects sample, I'm gonna do ABCs. So his airway is patent, breathing is increased, and I'm gonna palpate to find the circulation. Sample, there's pain in the neck and painful deformity to the left shoulder. Allergic to bees. The patient does have an emergency EpiPen, but doesn't take other daily medications. The patient has no known medical history, and his last oral intake was 2 hours prior to the fall. The patient was climbing in the tree when a branch broke onto his foot and he fell. There are no signs of decap BTLS, and I'm going to take the first set of vitals using the brachial artery, and I'm going to use his radial pulse, and I'm also going to find respirations. So his vitals are pulse is 130, respirations are 30, and his blood pressure is 120/80. For my interventions, I'm going to use C-spine to maintain his, to stabilize his neck, and I'm going to stabilize his arm and shoulder. My transport decision is I'm going to transport the patient to the hospital due to the fact that he has a possible anterior shoulder dislocation. And on the way to the hospital, I'm going to reassess the patient every 10 minutes. My missed report once I get to the charge nurse at the hospital is going to be, patient is a child approximately 8 years old complaining of shoulder and neck pain caused by a fall from a tree. Patient has a painful deformity to his left anterior shoulder. Treatment was stabilization of the shoulder and neck, and the patient has no known medical history, no known daily medications, but is allergic to bees and has an emergency EpiPen.